Hi, my name is Dr. Josh Hirsch, and I'm the staff psychiatrist at the Student Counseling Service. This talk will focus on how to recognize illegal drug use in the residence halls. It is important to understand which drugs are legal and illegal. Some drugs may be legal but are not permitted in the residence halls. Legal drugs include caffeine products, nicotine, and alcohol. Nicotine and alcohol are legal but are not allowed in the residence halls. This includes all forms of nicotine, such as e-cigarettes and chewing tobacco. Prescription drugs are legal and allowed in the residence halls, but must be in a labeled container with the student's name. It is considered a felony for a student to possess prescription drugs that do not belong to them. Illegal drugs also include traditional illegal drugs such as marijuana, heroin, and cocaine, and newer synthetic drugs such as K2 and spice, also called synthetic marijuana, and bath salts. The categories of drugs include stimulants, also called uppers, sedative hypnotics, also called downers, opiates, which include pain pills and heroin, cannabinoids, which include marijuana and synthetic marijuana, and hallucinogens, which include ecstasy, LSD, and mushrooms. The most commonly misused illegal stimulants at Miami are the prescription stimulants. And these are forms of amphetamine. About 9% of Miami students have admitted to misusing prescription stimulants without a prescription in the last 30 days. It is also common for students that are prescribed prescription stimulants to misuse their own prescriptions, such as taking the pills at night instead of during the day, snorting the pills, or giving them away or selling them. Other stimulants commonly misused include cocaine, bath salts, ephedrine, or Sudafed, caffeine, or nicotine. These are pictures of stimulants, and this slide illustrates pictures of prescription stimulants. This slide shows how higher doses of stimulants can increase the negative side effects. And these negative side effects can include mental effects such as hallucinations, paranoia, severe anxiety, and physical effects such as chest pains or seizures or even overdose. The most common reason that students misuse prescription stimulants on any college campus is cramming. There are also other reasons people misuse them, and those are listed on this slide. There are some signs that someone is using or misusing stimulants, and these include elated, animated, hyperactive, or manic behavior, lack of sleep, poor appetite or weight loss, paranoid or aggressive behavior, hearing or seeing things, or what's called crashing, which is sleeping for days and then feeling depressed after the binge. Sedative hypnotics are also misused by students, and these are usually obtained either illegally on the street or by physicians through what's called doctor shopping. These prescription sedatives can include Klonopin, Xanax, Ativan, Valium, and Ambien, and about 5 to 10% of students report misusing prescription sedatives without a prescription. Now, what's also important to realize is that these substances are often given involuntarily through drink spiking, which is also called roofying, with the roofies actually being a type of sedative hypnotic. These are pictures of commonly misused sedative hypnotics. The signs that someone is misusing sedative hypnotics or prescription sedatives include acting intoxicated with very little or no alcohol consumption. So if you run across a student that has drank very little alcohol or no alcohol and appears like they're intoxicated with alcohol, they in all likelihood have ingested a prescription sedative. And this might be voluntary ingestion, or they may have been a victim of something involuntary ingestion, such as drink spiking. Another sign might be someone that is addicted to prescription sedatives. When they run out of their prescription sedative, they go through a period of drug withdrawal in which they appear very anxious and sweating. Or another sign might be finding empty pill bottles or other drug paraphernalia such as razor blades or scales. Cannabinoids are also commonly misused by college students, and these include cannabis and synthetic cannabinoids. It's important to note that college student marijuana use has increased since 1990. About 15 to 30% of college students surveyed state they have smoked marijuana in the last 30 days. And what's also important to note is THC, which is the active ingredient of marijuana, has increased dramatically in potency since the 1970s. And this increased THC potency has caused many more negative side effects, such as anxiety and psychosis. What are the signs that someone is using cannabinoids? Well, many people are familiar with the term appearing stoned, which is characteristic of many signs of misusing or using marijuana, including increased appetite, slow reaction time, the giggles and bloodshot eyes. Another sign might be these severe episodes of anxiety and paranoia. Daily users often report poor motivation for daily responsibilities and academics, or one might find, as an RA, one might find drug paraphernalia such as pipes, bongs, rolling accessories, and scales. Opioids are also drugs commonly misused by students, and these include the prescription opiates such as Percocet, OxyContin, Opana, Vicodin, codeine, which is often in cough syrup, and fentanyl. They also include the street drugs such as heroin and crocodile. And these opiates are usually swallowed, snorted, or injected, and about 10% of college students use opiates or use opiates without a prescription. And this might be higher in intramural athletes, which often have had these athletes often have had some sort of surgery where they have been prescribed opiates, and which leads to an increased likelihood they will misuse opiates at some point during their life. Currently, opioid overdose or death from opiate use is considered an epidemic by the CDC. There are about 40,000 overdose deaths per year, and it's helpful to understand that overdose death is more likely with an infrequent user, someone that only uses these opiates from time to time. It's also likely after a period of abstinence or when they are mixed with other substances, such as, of course, alcohol or prescription sedatives. These are pictures of commonly misused opioids. What are some signs that someone is misusing opiates? Well, they might appear intoxicated at times or very sleepy. They often have very small pupils, glassy eyes, unable to finish sentences. Or they might appear in drug withdrawal. If they're a daily user and they run out of their opiate, they would have runny nose and eyes, excessive yawning, very large pupils, anxiety, irritability, and gastrointestinal symptoms such as nausea and vomiting. You might be able to find track marks on them, which are marks left by needles that follow a vein. You might find spoons going missing, as often the heroin is cooked with spoons. Or you might find these ties or laces in their pockets, which are used as tourniquets to prepare the vein for injecting. People that are injecting often use long sleeves in the warm weather to hide their track marks. You may find drug paraphernalia in the room, such as needles, empty drug bottles, or scales. About 15% of college students report using a hallucinogen in their lifetime, and this includes LSD, mushrooms, and MDMA. Those are the most commonly used hallucinogens among college students, although there are other hallucinogens gaining popularity. And these are pictures of the commonly misused hallucinogens. So what are some signs someone is using hallucinogens? Well, of course, strange behavior noted by the friends. They might be hearing or seeing things or be very paranoid. What's important to understand is that these symptoms can last for weeks after one ingestion in what's called a bad trip. And I've even seen them last for months or years. So what's important to realize, again, is that all of these drugs can create a medical emergency. And so as an RA, it is important to understand when is it a medical emergency and when should you immediately call 911. Well, if you encounter a student and they are found unresponsive, such as unable to waken them after shouting or shaking them, then it is important to immediately call 911. The student may also be awake but unable to answer basic questions such as who are you, what day is it, who is the president. In that case, again, it is important to immediately call 911. Or the student might be engaged in dangerous or threatening behavior. It is also important for RA to be familiar with when to write an incident report or when to call the police. So if you suspect any drug use by students, you should always write an incident report and consult your supervisor. This is very important information to pass along. If you actively see evidence of illegal drug use, you should call MUPD immediately. Do not take any substances into your own possession. So I truly believe that addiction is a disease and hijacks a person's brain and leads to a loss of control and continued use of a drug. And there are treatments which are very effective in treating this disease. So as an RA, if you identify someone that has an addiction, this slide illustrates some options. We do offer substance abuse evaluations at the Student Counseling Service, and these can be voluntary, where the students simply acknowledge they have a problem and come to see us, or they could be mandated after a code violation. We see students in all the different stages of change, which include pre-contemplation, where they're not even ready to stop using drugs; contemplation, where they're thinking about stopping using drugs; action, where they've made the decision and started to engage in behavior to stop using the drugs; and maintenance, where they've stopped using drugs, and the focus is on preventing them relapsing on substances. A lot of what we do, and maybe you could do some of, is what's called motivational interviewing, which involves pointing out the positives and negatives of continued drug use. And if we do run into someone that is ready to stop the drug use, we can provide counseling, we can provide resources and referrals. Thank you.